Okay, so I want to welcome everyone to the Concussion Resource Center October Education Series. The topic is acupuncture and oriental medicine and concussion recovery and stress management. I just want to give you a little bit of background about Concussion Resource Center and then a little bit of format about the presentation before I introduce our speaker. So the mission of the Concussion Resource Center is to provide resources to those affected by concussion, individuals affected, and also family members who are also affected in their own way. And if you want to receive our monthly newsletter or keep in touch with us and find out more of what we're doing, please go to our website, which is concussionresourcecenter.org, and join our mailing list, which is in the bottom toolbar on the right-hand column. And then you would receive our monthly newsletter that tells you what our next education series is and other things that we're doing at this point in time. One of which is we're doing a weekly iRest, which is a type of meditation series. Another thing is that with all of our resources, we're trying to make all of our resources free to those who've had concussions or family members or significant others. And one of which is the iRest series. So that's available on Tuesday evenings at 4:30. So I also want to explain a little bit about the format of this presentation. So it is being recorded, but we're not going to be capturing anyone's faces or names. Is that correct, Turi? Yes, that's what we did last month.
Yes, that is correct.
Correct, great. And so with that said, I do want you to keep in mind, especially during the question answer portion, that your question will be heard by others. So kind of for that privacy aspect of it, keep that in mind. And if you have a personal medical question and you don't want others to hear it, our speaker, Susanna, has offered to do a free 15-minute consultation. And if you require more time than that, you can get with her and find out what a full consultation would be. So everyone's muted during the presentation, except for the speaker. At the end of the presentation, you can unmute yourself and ask a question, and that would be at the bottom toolbar. And then also during the presentation, if you go down at the bottom, there would be a chat portion, and you can chat button, and you can go to there and then type in a question, and I'll be reviewing those and present those to Susanna at the end of the presentation. So anything else, Turi? Did I get kind of the basic aspect of
I think you covered it all. Thank you.
Okay. So now I'm introduce our speaker. I'm so excited to have Susanna Freeman here from Great Turning. And Susanna began her training in natural medicine in her teens with the study of nutrition. And after receiving a bachelor's degree with honors in environmental studies, she taught ecology in the national parks. I want to talk to you about that. That'd be so cool. She continued her study of nutrition, massage therapy, yoga, and meditation. So in 1994, she completed her master's degree in acupuncture and oriental medicine from the Oregon College of Oriental Medicine. She's been a nationally certified and state licensed acupuncturist for 25 years. Each year, she's deepening her knowledge and experience with continuing education and clinical experience. So I want to thank you very much for presenting today and taking the time out to be here. Thank you.
You're welcome. Thank you, Kathy. That was quite a mouthful. Nice to hear my bio read back at me.
You've done a lot. We need to give you credit for that.
Thank you. I know. It feels pretty good. It feels sort of like what do you call a journeyman, right? Like if you're a plumber or electrician and you start off, and then you get, more training. And then after a while, you're like, hey, I know something, right? It's kind of cool. So, and there's always more to learn. That's what I love about my work is there's always learning more. And our field in medicine is always learning and growing and shifting and evolving. So that's been pretty fun. There's never a quiet moment around here. So we're good to go? Ready? Okay, so we're here to talk about concussions and how you can use acupuncture in the broader system of Oriental medicine and what I like to call functional medicine in the application of concussion management. And we all know that concussions are a big deal. They're life-changing. The constellation, as we say, of symptoms can be really variable, and in some cases it can be lasting. And so we can use our tools as acupuncturists in any one of the constellation of symptoms. So we always use this individual approach to what is this particular patient's presentation, and where do we need to apply the focus? Where is their team approach being supported in other ways, and where do I fit in as an acupuncturist to fill in those gaps or provide sort of the center cog in the wheel to provide sort of a more holistic approach? Is it nutrition? Is it acupuncture, right? So we're going to go into that sort of detail today, but keep in mind it's always a very, very individualized approach and always a collaborative approach. I don't ever treat a concussion by myself. And as an acupuncturist, unless it's very, very simple, I may not be treating anybody by themselves. I always want to have your medical doctor on board and in touch with you with anything. Now, obviously, if it's a super simple runny nose or tennis elbow, I don't need a doctor on board, right? But if it's complex or chronic, I do, okay? And that's because I believe in collaboration and a team approach more than as a licensed acupuncturist in this state. I'm not considered primary care. We do have a medical director as part of Great Turning Healing Center who provides that oversight for us. And anytime I'm stepping out of my scope of practice, outside acupuncture, we'll talk about this in a minute, and herbal medicine, then I pull her in to say, okay, what do you think? Am I missing something? Are there any red flags here? What do you how can you add to this patient's overall well-being and care? So I'll do that either with our medical director or with the patient's primary care provider, or both, okay? So today we're going to talk about concussion, how to manage it. For the interest of simplicity, I thought I would narrow it down a little bit to pain, headaches, stress, sleep, and the sort of cognitive piece, which by that I mean our mood and our mental function. How are we thinking? How is our stress response? And so that can be a big topic, but it's also a big piece of concussions and a big piece of what we do here. And what I consider is one of my specialties and special areas of interest as I grow older and I watch all of the aging, baby boomers getting older and some brain decline being a big part of people's lives as they age. So it's really been a part of my focus. And so we can also apply that to people of any age. Teenagers, I'm noticing, need help with mood and sleep and anxiety and depression as much as anybody. So it's not age related, okay? So we're always collaborating. We're always thinking about the whole person, and then we're applying the tools in a way that makes sense for that individual. Okay, all good? So as an acupuncturist, here's a little bit of a misnomer that anytime I talk to the public, I always try to really educate people. When you go to a licensed acupuncturist in the state of Montana, for example, we're not primary care, like I said, but we are trained in this complete system, either called traditional Chinese medicine, or I like to call it traditional Oriental medicine, because we're drawing more from just Chinese medicine. But a lot of my acupuncture techniques are from Japan. We use a lot of herbs from all over Asia, and acupuncture really is spreading throughout the world. And there's research in Europe and the U.S. and all over Asia and all over the world. So it's really a global medicine at this point. So when you talk to a licensed acupuncturist, most of us are trained in far more than just the placement of the acupuncture needle into the body. We're trained in Chinese herbs, we're trained in nutrition, we're trained in body work, and we're trained in, so that would be massage, and we're also trained in the lifestyle arts of posture and qigong and how to cultivate our inner well-being with meditation and breathing techniques. And so it's really broad, and it's its own system of medicine. So we get a little stuck when you call and you say, well, I'm calling in acupuncture, so I think I'm just getting acupuncture. And then I come in and I'm like, well, let's talk about your gut health, or let's talk about your brain health, and let's talk about what you eat. And they're like, what? Right? So I try to sort of bring this point home that we're interested in all of you. So let's apply that now to concussion, okay? So in concussion, what we're looking at is pain, brain, stress, sleep, and then maybe other body systems like the gut-brain connection we're hearing a lot about in the media for good reason. It's really cool. The Chinese medical folks have been talking about the connection between the gut and the brain for 2,000 years. It's pretty exciting that we're all talking about this more now, and it does relate to concussion. So I'll get back to that in a few minutes. I want to talk about neurotransmitters and how the hormones and chemicals that our body makes influence our cognitive function and our mood and our ability to sleep and our ability to relax and our ability to fight off inflammation and generally be healthy and vital. So all these things come into play, not just acupuncture, right? So let me just get my head on straight myself here. So with acupuncture in particular, when you're talking about a concussion, we're going to use a variety of techniques. And let's use the example of a headache, because a lot of people with concussions have headaches from either daily or occasionally. So let's say it's a frontal headache. So here, it could be anywhere. Maybe it's coming from the occipital region. And usually with a concussion, you've got some cervical spine issues that need help with a physical therapist and an occupational therapist. And so I'm assuming that you're working on postural re-education and working with a therapist on the neuromuscular piece. And then what I'm going to do is collaborate with that therapist and that doctor to understand what needs to be adjusted in terms of, and I don't mean adjustment like chiropractic, what postural corrections need to be made through therapeutic exercise, postural awareness, and then acupuncture. So I'm going to, for example, if you have a headache and you have some cervical spine imbalances or inflammation, I'm going to use an acupuncture needle right here. This is large intestine 4, primary point to, it's on the radial nerve, right? So it's going to travel up through brachial plexus here, relieve a frontal headache, and it also has an influence on that cervical 6 vertebrae. So if you have any impingement or any inflammation in that nerve root around the C5 to C7 T1 area, right at the base of the neck here at the top of the shoulder, then this point can be really, really effective. Or I might choose one of the other points in the hand. So I'm going to try to relax and calm the nerve signaling, the inflammation, the tension with that point and with other points. Before I ever go anywhere near your head or your neck, I might never actually touch your head or your neck with a headache. I might go to your feet. I might go to your hands. I'm not going to go straight to the head because generally that's stressful. So I just had it happen this morning. There was a point in the ankle that I did on a patient right down here, as if this is your foot right here. And that relieved her temporal headache. So when you put a needle in here, there's several things that are happening. There's a local stimulus to this point that will help influence chemicals, release of chemicals, local circulation here. But in the case of a concussion, what we want is the more global response, where that nerve impulse and these other signaling transmissions that happen with acupuncture, the release of nerve sensation up into that radial nerve, up into the dorsal horn of the spine, releasing serotonin, releasing all these anti-inflammatory compounds, releasing signals and chemicals that calm the nervous system and calm inflammation and calm tension, like oxytocin, I'm sure you've heard of, and serotonin, and all these other inflammation reducing chemicals and nerve signaling into the central nervous system and into the local spine area to calm down that stress response and that pain signal. Okay, so acupuncture has a very local response, and it also has a response up the nerve pathway into the brain. And then when you feel it and you tell me, oh, I feel that, then that tells me that we're now working in the brain to influence the area of influence from this point. Okay, I hope that's making sense. It's a little bit hard to describe acupuncture to the Western trained mind because I can't just talk in terms of meridian theory because it doesn't make sense unless you've studied Chinese and Oriental medicine. So think about it in terms of nerves, and then there's also this extra mechanism that we don't fully understand yet. All the research scientists are clear that there is a mechanism behind acupuncture, and they can explain about 99% of it, but not the last 1%. So we're still waiting to really be able to explain acupuncture fully. And until then, what we do know is that these signals are happening through the fascia, through the nerves, and through the signaling process in the body that we can influence pain from a distance. And then you get the local response. If you put a pin in here, very carefully and gently, of course, when you're on the face, that can reduce tension locally. If you put a pin into the back of the neck, that's going to relax those muscles, relax those nerve signals, and promote local circulation, reducing inflammation in the local area, as well as the more global, okay? So that's a very rudimentary, basic explanation of acupuncture and how that might work for a headache. I might use points anywhere in the body, but specific to the channels and pathways that play into the nerves and the meridians that go into the aspect of the head that needs to relax and calm and reduce pain. Now, in the case of concussion, we might be doing a more modern approach to acupuncture that actually thinks about the centers of the brain that control motor function or sensory function or eyes or vestibular, and actually treat points on the scalp that relate to what's going on inside the different centers of the brain immediately adjacent to the scalp. We don't ever actually go into the scalp, right? We're always on top, so don't worry about that. So that's scalp acupuncture. We'll also There's been some really nice developments in the last 10 years with microcurrent acupuncture, where we're actually attaching a small little lead onto the metal shaft of the needle and directing an electrical current into the needle in very specific ways with very specific frequencies to influence brain signaling and reduction of tension, and to increase certain neurotransmitter and chemical signaling, and to decrease those catecholamines and those fight or flight responses and those stress and pain responses. So very, very specific, highly technical, and really exciting, effective treatments for pain and stress and cognitive function and mental emotional disorders. So I use the electro acupuncture quite a bit, and we have various frequencies and various settings we can use. We always make it comfortable. There's a rule here is no pain ever. It's not a no pain, no gain. I do want you to feel it, and sometimes that can be a little strong, but it shouldn't ever be registering as pain or stress. It should always be comforting, okay? So that's acupuncture. We've got a whole host of other things that we do, but that is one of the primary tools that I will use if somebody's come in with a concussion. I guess the other thing I would say is that if you have some very specific muscles or nerve inflammation at the certain levels in the spine, or certain muscles that are tight, we always fall back on trigger point therapy, where if it's the muscle is tight and we haven't been able to release it fully from a distance, then we go in with a needle very, very carefully right into that trigger point and stimulate that and release that tension locally. So when it hurts here, you treat it here. We do use that local approach all the time, but I will start with a more distant approach first, calm down the nervous system, calm down that stress response, improve the state of well-being in the patient, improve their postural awareness, improve their overall posture. We all tend to sit like this all day, so trying to open up and relax and open up the heart, open up the breathing, and bring that vagus nerve into better regulation, improve that signaling and improve the chemicals in the body that promote well-being. So serotonin and the dopamine to help you get up and going during the day, and the GABA to help you relax at night. These are all things that I'm thinking about in my head when I'm treating somebody, not necessarily what you're going to hear about, but that's what I'm thinking. Okay? So
it's a good time to ask if there's any questions before you move on to another topic, or are you moving away from acupuncture?
Yeah. Any questions about acupuncture specifically?
You can unmute yourself or actually hold down the space bar as you talk, if anybody has any questions. Okay, I find it very interesting. I want to come. So.
Yeah, it's fun. And I guess I would say, I want to give you all a sense of what I'm thinking in the background when I'm treating a concussion picture, or anybody for that matter. But the experience that I'm looking for with you as a clinician, treating my patients is, I want you relaxed. I want you comfortable. I do want you to feel the acupuncture. I want you to feel different when you leave. I want you to feel better when you leave, obviously. And I want to give you some homework so that you can help improve your condition on your own, and that we gradually, as the acupuncture has its influence to improve your function, that then you can take that over and do it on your own. So that's where the next step comes in, and that's where Kathy and Turi, you come in with teaching the patients, okay, here's what you're going to do in your daily life to stay well, right? So the whole job here is, I want to work myself out of a job. You're going to rely on me in the beginning to help improve the tissues, decrease the inflammation, decrease the pain, improve your strength, improve your posture, improve your brain health, improve your mental health and emotional health. And then what can we do to help you maintain that on your own? Okay, all good? So that's where the rest of Oriental medicine. Oh, did you have a question? No? Okay.
Yeah, I had a question. There was also something about Yoga Nidra on Tuesday night. And so if you could go over that again before we're done,
we'll get
about what time and how to do that.
I think it was 5:30, right? Yeah? Okay.
4:30.
Oh, excuse me, 4:30.
But we'll go over that at the end.
Okay, good.
Thank you.
Yeah. Okay, so when you're looking at Oriental medicine as a whole, so we've already talked a lot about neurotransmitters and the gut-brain health. This is where the nutrition and the lifestyle medicine comes in, okay? So we want to, we have this adage, we use the 3 T's. We test, treat, and teach. So we're doing all that with acupuncture, but we also want to assess your brain chemicals, your hormones. I don't do any actual hormone treatment here. Everything I do is precursors, meaning giving your body the raw materials it needs to produce its own. Okay, that's what I mean by a precursor. So we need to assess, how is your gut? How is your nutrition? How are you making the chemicals, the neurotransmitters, the serotonin, the dopamine, the GABA? Are you making these well-being chemicals on your own? Are you able to detoxify? Are you able to work with inflammation internally in your body? Do you have the blood sugar management that you need to keep your cortisols in check so that you can stay relaxed and have good blood sugar and good healthy functioning into your brain during the day, and then have it calm down at night? Does your body produce melatonin properly? Do you have enough vitamin D? All these things are super, super important when it comes to managing the whole person with a concussion, all right? So we use assessments, we use lab tests, we pull in our medical director or your primary care provider whenever we need to make sure we have the information we need to then build out and round out a rounder picture on what nutrition and well-being would look like for you. So, but in particular, what I'm looking for is the gut and neurotransmitters and hormones and cortisols. Those are the things that really, really jump out at me when it comes to nutrition with concussions. And I'm also, like I said earlier, interested in the gut, because that's where your body makes all of these chemicals that help us signal into the brain our states of well-being and our ability to relax. So the adrenal glands are important, the HPA axis, if you've heard of that, the hypothalamus, pituitary, adrenal, and thyroid axis is super important. And then I translate all that into traditional Oriental medicine and give you the foods and the herbs, the vitamins and the minerals and the herbs that you need to then balance those systems and those hormones, okay? So a couple of things that we can just think about in terms of nutrition. I want to use the example, we're heading into November and the holidays and Thanksgiving. So we've probably all heard about how the Thanksgiving, the turkey dinner, everybody falls asleep later, right? And what is that about, right? Well, that's about, so here's an example of how turkey is high in tryptophan, this amino acid that happens to be a precursor into serotonin. And so that's one of the things that we can do is say, okay, what are the vitamins, minerals, and herbs that we can put into your diet that we're going to help promote those pathways, all right? So that's one very specific thing. And then some of the other very specific things that I always want to make sure with a concussion patient is, are you getting food for the nervous system? So my short list for that is B complex vitamins, and preferably always from food, but also a lot of people don't absorb or get enough in their diet. So I'd like to see people on a methylated B vitamin, and that means that I know that you're absorbing it really, really well. And we can always work with your doctor if we need to on this, but these are available over the counter. So right away, look in your kitchen cabinet and look at the B vitamins, and it should say folate rather than folic acid. If you really want to optimize your nutrition with your B vitamins, folate is it's usually food-based, it's a better absorbable, highly nutritious form of one of those B vitamins. The other one is vitamin B12. It's fabulous. It's a dopamine precursor to help you get up and go during the day, give you energy, give your brain some energy to work with. And B12 should be methylcobalamin, not cyanocobalamin. So those are just some little tips I can give you right now. The other big nutritional piece that I want to give you is omega-3 fatty acids, especially DHA. So there's DHA and EPA are the two big types of omega-3 fatty acids that we want people's nerves to be fueled with. These are the omega-3 fatty acids, and DHA has a really nice profile to help support brain health. So DHA in fairly high doses, so fish oils, please, 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 don't go to a cheap source. Go to a source that's testing every batch. You do not want heavy metals in your body from your fish oil capsules. So we have all that stuff here. We can give you a list of good companies to use, but we are kind of a little bit neurotic about the fish oils we use here, and make sure each company is super clean and they're paying attention to where they're sourcing their fish. So we use the small fish whenever possible, cod, tuna, whenever we can, and make sure it's sustainable and clean, okay? So that's important. And then there's some more specialized nutritional approaches that we take that are from sort of an old school nutritional food as medicine concept, and that is something you work with me directly on. We have some really nice brain health protocols that are using food-based vitamins and minerals to promote brain health after an injury, or just if you're feeling like you need some cognitive support. Probiotics are another big one that I want you to make sure that you're doing. There's lots of evidence now that probiotics in certain strains of bacteria can literally feed the brain, and there's another nutrient from the gut that's super important for the brain called butyrate, and you get that from grass-fed beef and coconut and dark green leafy vegetables. Those are all really, really important to fuel that brain with nutrition. So eating a burger and eating some kale, and make sure that burger is grass-fed all the way through, not grain-finished, will help improve your omega-3 fatty acids, okay? So that's one of the key things that we do just right off the bat when somebody comes in, is making sure you have this sort of top list of omega-3 fatty acids, Probiotic, we assess which probiotics your body needs based on which neurotransmitters and you're lacking in, and we do all that with clinical assessment. And there are some tests available, but I like to just do clinical assessments. And then the last thing is that lifestyle medicine that Turi speaks so well to as well. So we want to talk about the vagus nerve that regulates the gut-brain connection, regulates all of our internal body functions, and then in turn helps support our rest and repair and our parasympathetic nervous system. They're all working together. So if you have butterflies in your stomach when you're stressed, that's the vagus nerve being dysregulated. So when you have a concussion and you're stressed, or you're not thinking well, or you're not sleeping well, oftentimes the vagus nerve is dysregulated in addition to everything else we've talked about. So there's some really simple techniques that we can use to regulate the vagus nerve and also to bring down that sympathetic or fight or flight response. So one of the most important things we can do is to breathe, period. Right? So we're going to end with a little breathing exercise, but before we get there, I want to talk about a couple other things about lifestyle. So sleep is super, super important. We want to work with you on your sleep, whether we do that with acupuncture, Chinese herbs, nutrition, lifestyle, meditation, or all of the above. We need you to sleep. We talk about having to be active during the day, and then we want you to rest at night. It's the yin and yang of movement, super, super important to a healthy individual. So vagus nerve, breathing, and meditation, or any meditation can include anything that brings your body into a state of well-being and brings you into a state of awareness that you can then use to go, oh, I'm feeling a little stressed. What can I do about that? How can I manage my state right now so that I improve my well-being, even if I'm in pain? So that's what we teach with meditation, and the iRest is fantastic. I love it. And one of the things that I would offer you as well, one of our other little tidbits, is out in front of our clinic. I'll make sure I give you the address. It's 81 West Kagi. We're at Great Turning Healing Center. We have a little drop box for people since COVID, where people come outside and pick up their herbs or whatever they need. We have a little mindset morning handout in there. It's a beautiful little 15-minute exercise you can do each morning to just help support the dopamine, help support meditation, help support you greeting your day with the way you would like to be in the world and the way you would like to be in your body that day. It's a lovely, easy practice. And it's not to take the place of a full meditation practice, but just a little jump start, just a little get your mind pointing in the right direction for your day, or you could do it the night before. And so come by our clinic. It's in our Dropbox. It's called the Mindset Morning. It's also on our YouTube channel, Great Turning Healing Center. So let's finish up with some breathing. So this is from the yoga and the Oriental medicine tradition. I call it box breathing because it's so easy to remember. You're going to think of a box. So you're going to start with a count of 4, and that you're going to inhale for a count of 4. I'll lead you on this. You're going to hold for a count of 4. You're going to exhale for a count of 4, and then you're going to hold at the bottom for a count of 4. If you get stuck and jammed up, just take a couple normal breaths. When the count of 4 is easy, go to 6. When the count of 6 is easy, go to 8. So you can do this for several minutes. I also love when I'm sitting in a stoplight in traffic or I'm waiting on hold on the telephone, I'll just do some breathing. And it's a beautiful way to just bring yourself back into the present moment and go, okay, right? So let's all just take a moment, make sure you're sitting on your sits bones, make sure your chest is pretty open, make sure you're just tuned in a little bit to your own internal state of well-being right now. It doesn't matter how stressed or in pain or relaxed you are. And I want you to all breathe out together all at once. Breathe out all the way. And then you're going to inhale. 1, 2, 3, 4. Hold. 2, 3, 4. Exhale. 2, 3, 4. Hold. 2, 3, 4. Again, take a normal breath if you need to. Inhale. 2, 3, 4. Hold. 2, 3, 4. Exhale. 2, 3, 4. Hold. 2, 3, 4. And keep doing that for several minutes, and I can almost guarantee you will feel different. So with that, any questions? I'm sure I left some things out, but fire away, and I look forward to meeting any of you. If you would like a short consultation to just say, well, what would this look like for me? That's just fine. So it's Great Turning Healing Center, and our website doesn't have the word center. It's www.greatturninghealing.com, and we're at 81 West Kagi, and that's in the Southwood Complex between Tracy and Wilson on Kagi, and our phone number is 406-599-0088. Thanks, everybody.
Any questions? Fabulous, great information. I actually had a couple questions. So it sounds like to find out if neurotransmitters or the hormones, it's just by their description of their difficulties or their challenges. Is that how you're assessing that? Is that what you meant?
Good question, Kathy. I know it's complicated. So there are some organic acid tests and urine tests out there that do test neurotransmitters in the urine. I don't know. It's not my area of expertise, and I'm not convinced they're as accurate as they need to be. They're certainly an indicator. What we tend to do is to use a broad range of clinical signs and symptoms, like you mentioned, and then assessment tools that we've gleaned from all over the place from brain specialists. There's a bunch of really nice tools out there from people in the neurobiology world, neuropsychology, and neuro everything, brain health everything, right? So that look at hormones, and look at neurotransmitters, and so you can use the symptom picture, and then you tie that in with their blood chemistry, tie that in. We do use some salivary hormone testing that looks at cortisols and DHEA, and the sex hormones are less important in this case. The estrogen, progesterone, and testosterone, they can be a player at times. Certainly if a woman is perimenopausal, that can affect their stress response. But generally, we're looking at cortisols. We're looking at precursors into those, so that you can test really easily. We use our medical director or the patient's doctor for that. And then we use lots and lots of tricks and tips and clinical strategies from Oriental medicine and from functional medicine. There's a lot we can do to assess somebody's condition. And then just simple little things like, how do you sleep at night, and how's your stress response? There's a lot we can do. So that's how I spend my day, is how can I diagnose this person beyond what they're just telling me with their symptom picture? And then I put it together. Does that help at all, Kathy?
Yes, it does. And I find a lot of my clients do have, I'm just learning more and more about the hormonal aspect of it and the neurotransmitters and how important that is and how that's overlooked so much of the time.
It's fascinating. And there's a lot that you can see, or at least get started with, going, looking at just the basic wellness panels that people get usually every year from their doctor, that just the CBC and the Comprehensive Metabolic Panel can actually give us a lot of information. So we use that every day.
Mm-hmm.
Yep.
Great.
Yep.
Any other questions? I did wonder if you have that Mindset Morning on a PDF, whether you could forward it to us and whether you'd mind to us.
Yeah, I can do that.
Would it be okay if we put it on the website or connect it to this presentation?
Yeah, you bet. So just email it to you, but I can do that. Mm-hmm.
That'd be great. Last time we had handouts that we presented or gave out before, but if anybody wants to get this link for the recording, then I could provide that to them as well.
And it's not specific to concussions. It's just for everybody to just have a little something that you can do. Sometimes people do it the night before to set themselves up for a good night's sleep, right? And it goes along with eye rest and meditation. It's very accessible and approachable.
Great. Any other questions? So thank you for this great presentation. That's
You're
just
welcome.
when we were talking before the presentation, I just thought it can be a great resource for us, and you will be. So
Yes.
I'm looking forward to be able to have
Thank you.
several clients. I'm going to be giving them your information tomorrow or next time I see them. So
Yes, will do. Yeah, and I'm so glad that the Concussion Resource Center, that you all are doing this, because I do see, like we were talking earlier, I do see almost all of my patients have head injuries in their history. I know I do. And obviously there are lots of times when we get a bump on the head and we recover and we're done and then we move on, and then sometimes it sticks with us, and sometimes that can be hard to track. So having a team approach and having lots of tools we can look at and like, is this coming out of that head injury, and will that give us an idea about how to improve your health and well-being?
mm-hmm.
Right? So it gives us information that we maybe wouldn't ordinarily have. And that's in terms of being able to help people be more well, which is ultimately my goal.
yes,
Yeah.
like all of ours here.
Right. Yes. Thank you very much, all of you. Thanks for your attention. And
Yeah, I
Thank
was
you,
wondering if
Suzanne.
Curry wants to tell us a little bit more about the iRest.
oh, good.
Sure, I'd be happy to. So the iRest Yoga Nidra, we offer that on Tuesdays via Zoom at 4:30. And iRest, for anybody that's unfamiliar with it, it's a guided meditation practice, and it can be done seated or lying down. Most people do it lying down. The intention's to calm and soothe the nervous system and to allow the greatest amount of rest and restoration. Lying down is often preferred for that. And as a guided meditation, there are very few pauses, so the mind doesn't wander off as easily. You're following more along, and you're out of the thinking mind and into the body. And as we're doing that, that is what helps us shift from our fight or flight, the sympathetic, to our rest and digest, parasympathetic nervous system. So the meditation itself is approximately 30 minutes. We start with a little bit of an intro and have a little bit of time at the end for any questions. Usually there aren't very many because people are so deeply relaxed. And the wonderful thing about Zoom and doing this on Zoom versus in a yoga studio is that you don't have to get up and go anywhere afterwards. No getting in a car, no dealing with traffic or icy roads. You're in your own home. And it's really quite lovely to do it in the afternoon. And then you can just linger there and make a slow transition at your own pace back into your day. So if anybody would like the link, the Zoom link to connect for the class, contact the Concussion Resource Center or contact me directly. It's turihetherington@gmail.com. I'll spell that out because it's a mouthful. Turihetherington@gmail.com, and I can send you the Zoom link and any other information that you would like regarding the practice. And thank you, Susanna. That was very informative. I really, really appreciated all of that content. Thank you.
You're welcome.
Yeah, that was really nice, Susanna.
Oh,
I should
good.
come in and see you. You can.
All right, David.
That'd
We're
be
going to
great.
go out on the ski trails pretty quick here, right?
Oh yeah. Oh yeah.
Very good. Either way, we'd love to have you in here. Yes. And thanks for your being my Dharma brother over the years in our meditations. All good?
Yep.
You all set?
Okay. Bye-bye.
All right. We all set, Kathy?
Yeah, I was going to say one more thing. The education series is on hold pretty much for November, December, just because of holidays and things, and then it'll resume in January if anybody else wants to do that. So get back on, and those will be listed through our website. So thank you again. Have a great
Okay.
evening.
All right.
Okay.
Thank you so much.
Thank you.
Kathy.
Thank you very much.
All right. Thank you, Terry. Bye-bye.
Bye-bye.